Sleep apnea has a major impact on the patient, but it also has the impact on the surrounding. So there have been cases, lots of cases of divorces happening in the Western countries. In Indian scenario, the Indian spouses are far more tolerant, but they tend to complain, and they come to me in the clinics and they come and tell me that, oh, well, I can't sleep in that room. I have to. They start sleeping separately in different rooms. OSA treatment should be taken very seriously because sleep apneics, depending on how severe the disease is, he can die during sleep, number one. Number two, they have a whole lot of comorbidities like diabetes, hypertension, dyslipidemias, increased risk of coronary artery disease, heart attack, stroke, and also increased incidence of cancer of any part of the body. Well, sleep apneics, first of all, they have a daytime somnolence, hypersomnolence, sleepiness, tiredness, fatigue, mood changes, depression, irritability, all these things put together in one patient. And they tend to sleep off while driving, they tend to have more motor vehicle accidents. Their social life changes in the sense that because of these factors, they tend to mix up with friends and people and family much less than a normal person would do. And this has been proven by researchers all over the world that as you treat sleep apnea, and it has been also shown that CPAP has reduced of course, after abolishing the sleep apnea, reduced the need for dependence on the treatment for hypertension as well as diabetes, because the sugar levels came down, the glycemic control started to improve, and the blood pressure started to come down once the patient was treated with devices like sleep apnea. Both in terms of their mental alertness, daytime alertness, and their even memory improves, and their physical being, the muscle aches, the body aches, the tiredness, fatigue, it tends to disappear to a large extent within a few days of the application of CPAP, because it happens almost immediately. You start using CPAP, next morning you can see the results. By 3, 4, 5 days or a week, the patient tells you all good things about how he's feeling. One of my patients comes from Ludhiana, an industrialist. He has a factory with about 60 workers. He had an interesting story to tell me when he got better. He said, before I got the treatment, I got the diagnosis and treatment, my staff was taking advantage of me. They would get papers signed by me because I was half drowsy. I used to sign, and probably I lost a lot of money also like that. Probably I signed some checks also. And what time people would come and go, I wouldn't really keep track of that. And now everybody is scared of me. A month later, after starting treatment, they are not happy anymore, because now I can know what is happening around, and I'm having a strict vigil on them. Now I come to know what's been happening around. So everybody is scared of him now. So this is a dramatic example of what within a few days or weeks, the patient can practically change so much.
Innovation and you. Philips.